Now it is my pleasure to introduce to you Amanda Johnson. She's from Urban Polling, and probably a lot of you have seen her at the very back along with her husband. She's now going to share with us the power of movement and the sport of Nordic walking. So I'm going to turn it over to Amanda.
Hello, everybody. I am the Urban Polling representative for Alberta, so disclosure, I work for Urban Polling. It's a Vancouver-based company. My territory is Alberta. This is not Alberta. It's not Canada. This is where I was last month. My husband and I took a group Nordic walking on the Amalfi coast of Italy. There were 18 of us, and in that group there were 2 with total knee replacements. I was one of them. 1 with double hip replacements, and somebody waiting for a knee replacement. And it was fabulous. So my goal is actually to make Nordic walking poles as popular as those things that we carry around with us. How many have a cell phone here today? Hands up if you have a cell phone, yeah. So wish me luck with that. It's a little bit of a challenge. It's a growing fitness trend, and it really is like cross-country skiing without the skis. And if I had $1 for everyone who looked at me and laughed and pointed and said, "You forgot your skis," I'd be a millionaire. And if I had $1 for everyone that I talked to about this who said, "Oh, I don't need to use those, I'll use them when I'm 80, I'd be a multimillionaire. But let me explain to you the benefits of this growing fitness activity. So this is, if anyone watched the Winter Olympics last year, this was the gold medal winner in the final event of the Winter Olympics, the 30-kilometer ski marathon. And yes, she uses Nordic walking as part of her elite training regime. So this activity started as off-season training for cross-country skiers. And they are the fittest of the fittest when it comes to aerobic capacity, their cardiovascular fitness. But the neat thing is that, I wish I had her six-pack abs, that although this is a super fitness activity, it also has amazing benefits for people with mobility issues, and none more so than people that have arthritis, especially in the hips and the knees, osteoarthritis, but also for people with rheumatoid arthritis, and even if you have it in your hands. So this next diagram here shows that when we walk, we use the muscles from our belly button down primarily, so our legs and our butt. And when we walk with poles, we add all the muscle groups that are in gold. So your stomach muscles, what are called your core muscles of your trunk, your chest, your shoulders, your arms, and your back muscles. And does anyone here, a question, skill testing question, does anyone here walk with a pedometer or a Fitbit? A few people. Do you know how far you walk when you walk a kilometer? How many steps? Sorry, how many steps you take? All right, it's about 1,200. So let's just round it off at 1,000. So you take 1,000 steps. So when you walk with those poles, if you are contracting your abdominal muscles every single time you plant the poles, the next skill testing question is, how many times do you contract your abdominal muscles when you walk a kilometer? 1,200, the same. And for your chest and arms, it's half that because it's alternating. So over 500 times, right? If you're using 90% of your body's muscle with every step that you take, what do you think that does to the caloric expenditure, the calories that you burn when you're walking? It goes up. It's about, research has shown it's about 20%. And this is good because the physiotherapist, what was his name this morning? Trevor mentioned that maintaining weight is important, especially because it decreases the pressure on your knees and your hips. There's a lot of research to say that for every pound that you gain, it exerts 4 pounds of pressure on the knee joint. So if you're 10 pounds overweight, that's 40 pounds. So this is a great a great weight management tool. And also, if you're on uneven ground, I like to call this four-wheel drive for humans. You've got 4 bases of support, right? You're pretty well invincible. That's far more support than walking with a cane. And with a cane, we've got 3 bases of support, but with 4, as I said, I call this four-wheel drive. So it doesn't even matter if the ground is uneven. even on even ground. Pressing down on the handle of the poles allows you to offload some of the weight from those painful joints and take that load to your upper body. This is compounded, this effect of stability is compounded in the winter time. Now this is my crazy friends and I. We are hiking up a frozen river, and not only do we have our poles, but indeed we do have icers on our feet, all right? And this is Fall Prevention Month, so I'm going to just slip that in there, that in addition to the poles, there's studies that show that 80% of our footwear fail the basic slip test, so we're at great risk of falling. So if we have boots that pass the slip test, or if we add these icers to our feet, I really wouldn't recommend you go out and do this, but we can do this. We can go out and enjoy Edmonton in the wintertime, right? We can keep active throughout the winter. This is at the Ice Castle. Edmonton is a winter city, and we don't need to stay indoors and get depressed and think that we've got to cut back on walking for the entire winter season. So I want to come back to the offloading of the joints. So again, Trevor mentioned that it's good to do aerobic exercise that's gentle. He mentioned Aquafit, because again, you are using your muscles, but you don't have as much weight bearing down on those critical joints. So it's the same with the poles. And I'm going to have everybody do an exercise at this point. It's very brief, but I'd like everybody just to stand up. And I would like, actually, we're going to use I want you to put your hands on the shoulder of the person in front, so the person in front of you. So, yeah, so like a choo-choo train. One hand, so put a hand on the shoulder, take your other hand, put it on your tummy, right? Now I want you to push down on that person's shoulder as if you're trying to make them sit down and feel what happens to your tummy. Can you feel that? Yeah? Put your hand on your chest, yours, nobody else's, on your chest. Push down and relax. Push down and relax. You feel those chest muscles working? Yeah, do the same thing here with your tricep muscle. Push, relax, push, relax, push, relax. Okay, you got it. So sit back down again. So this is what happens when you walk with the poles. Every single step you take, you're pressing down on the handle. And every single step you take, you're contracting all those core muscles and you're offloading weight from your lower body to your upper body. And now and you can imagine how that's compounded. This was back in Italy. This one day we actually did over 3,000 steps. And everyone had poles, and at the end of the day, people were complaining about being tired and sore calf muscles and sore quads, and sore bum. Nobody was complaining about sore knees and hips. All right, there are two different techniques, and I want to very quickly explain the difference. How much time have I got left? 9? Oh, tons of time. So this is the fitness technique. This is like cross-country skiing. The poles are planted behind you, and you're pressing yourself. It's called plant, push, and propel is the basic technique. Push, 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 and we're contracting all those muscles with each step. So this is the version that more mimics cross-country skiing. And this gets us the maximum kind of aerobic activity, the maximum benefit of contracting all those muscles. But this technique is the one that we suggest for people that are having some issues with knees and hips, feet, lower back. So the poles are planted upright. You can still see that there's a matching. Every time I take a step, I plant my pole. 1, 2, 1, 2, and I'm pushing down, pushing down, pushing down, pushing down, pushing down. So now I want to talk a little bit about the different kinds of poles, because people will say, can I do this with my ski poles? I have hiking poles. Well, I'll say you can play tennis with a badminton racket, but it doesn't really work that well. So there are some specifics, and this is why. I did bring along my ski pole. It has a simple strap, which is made just to attach the pole to your hand. It's not made for bearing down and pushing down to offload weight. So if you do this, your wrist is not in a neutral supported position, and you basically have to have a really strong grip on the pole So you could do it, but you have to really grip tight. If you've got arthritis in your hands, that's not such a good thing. But the main reason is, if you're strapped into poles and you fall, there's a very high risk that you're going to strain or dislocate your thumb. It's that common in skiers that doctors call it skier's thumb. And as a skier, I've actually done it twice, so now I actually have arthritis in the base of my thumb, and I can hardly grab anything. It hurts so much all the time. The other difference is, other Nordic walking poles have, like a high-end cross-country ski pole, they actually have a glove-like contraption, a strap. It takes me a long time to put it on, so just imagine, it wraps around, right? And you're wrapped in really tight. So it's you can't just, if you have poles without a strap and you do happen to fall, you can just drop them. With these, you're kind of stuck. And there's a good reason at downhill ski resorts, there's a great big sign that says, remove your straps before you get on the chairlift, because if you're attached and it gets caught in a piece of equipment, you're going to do some serious damage to your body before the strap breaks. So that's the difference between the different poles, because people will say, you know, those can't be very good, they don't have straps. But what they have is a ledge. And by holding on here, this ledge is the magic that allows me to push down. Look at my stomach when I push down on the handle. It gets the core muscles to work, which is going to lift the pressure off your knees and hips. And you also don't even have to grip it tightly. So I like to keep a really loose grip. It's not going anywhere because there's a ledge at the top and the bottom. So that's how they're different from ski poles, hiking poles, and other Nordic walking poles. So I want to finish with a bit of a success story as well. This is Bonnie. She's a nurse. She was a nurse, but now she's a personal trainer and an urban poling instructor. She's had 2 hip replacements and a knee replacement. And this is her on the Camino de Santiago. So that's an 800-kilometer hiking trail that goes through France and Italy. And she's at the top of this peak in the Pyrenees with a 4,000-foot climb. And she said she works with a lot of patients. And this is echoing what Trevor, the physiotherapist, said this morning, that people's natural inclination when they start to suffer with the pain of arthritis is to be afraid of moving, is not to move, to stop moving, kind of give up on activity. And she says the biggest advice she has to give people is just to keep moving. And not go and do the Camino next year, but to start with those 5 and 10 minutes. Because remember what I said, in 15 minutes, you can walk a kilometer. And if you have a pedometer, is that 1? 2. You will take over 1,000 steps. So you can do a lot of good. So when you're walking with poles, it is the combination of aerobic activity plus strength training. So you're getting 2 in 1, right? You're getting your aerobic training for your heart and burning the calories, and you're strengthening all your muscles, everything from the neck on down. I guess, being as I have a minute, I can tell one more success story, and that is mine. As I mentioned, I had a total knee replacement 13 years ago when I was 48, and at the time the doctor said, my passion is hiking. And I said, can I still hike? And they said, well, yes, if you stay on the flats. Well, that's not hiking, that's walking. So we went up and over, I'm kind of a rebel, so I didn't take their advice. Went up and over the Andes to Machu Picchu. We live in Canmore. I've hiked most of the mountains, and I went back for my 10-year follow-up for my knee, and I was very concerned that because I had it done at a very early age and I'd been extremely active, that I would be wearing that prosthetic device out. And the doctor looked at my x-ray and said, whatever you're doing, keep on doing it, because at 10 years, your knee replacement is in excellent shape. So I went, whew, thank you. So that's my story. And people have asked at the back already, well, where can I do this in Edmonton? And if the gentleman at the back would please pull up the website. The Edmonton Federation of Community Leagues, they believe in this not for arthritis or for fitness, but for socialization, for community building. They've trained over 30 instructors. They have a website here. EFCL is the Federation's general webpage, and they have a section called League Walks, League Walking Program. And if you scroll all the way down to the end, and again, unfortunately, I think all 28 of those 30 programs are are finished for the winter because nobody wants to walk in the winter. It's the most beautiful time to go walking. And right now, Cloverdale Community League is still walking. They go near the Matart, so you know where that is. And there's the instructor's name and her phone number and her email address. She's had a hip replacement, and that was because she used to be a triathlete and wore out her knees from running. And I think also the Strathcona Community League, the last I saw, they were still walking. So that's my story. I'm still at the back. Thank you very much for listening.